My name is Dr. Aris Mosley. I am the Medical Director and Psychiatrist for the First Episode Center, Avondale. I remember wanting to be a physician probably around the age of 5. My mom says is around 2. I just knew that I wanted to be a baby doctor, so I'm assuming that that meant like a pediatrician, but that has always stuck with me and it has never changed. That was always going to be my path no matter what. Throughout medical school, I kind of went from wanting to do dermatology, and then ultimately I ended on believing that I wanted to do cardiology. But one of my last rotations was actually through Valleywise, and I had the opportunity and truly the blessing to rotate under Dr. Dave Neverstogie, who is the director of our residency program. And she showed me what it means to be a psychiatrist with the heart. And so at the midnight hour, I switched, and it is the best thing that's ever happened to me. A lot of people think of psychiatrists as like shrinks or head doctors, and we just, give out pills. But we are working with individuals at oftentimes the most vulnerable time in their life. It doesn't matter what they're suffering from. Is it schizophrenia, bipolar disorder, anxiety, OCD? It doesn't matter. Their brain has turned on them. In essence, it's lying to them. And that robs an individual of stability, understanding, and it's confusing and it's scary. So if you provide a service, support with a heart, you're saying, I see you and I'm with you and we're gonna figure this out together. And that's what I try to continue to emulate and teach the coming generation behind me, the residents and the fellows and the medical students that I have the opportunity to interact with. Every single day is completely different. I work primarily with young people with schizophrenia, but that doesn't mean that every single one of those people are going to present in the same way. I can have a young person come in one week and literally the next week their symptoms can look different. So I don't think that maybe people understand that it's an ever-changing process within the brain, as maybe it ebbs and flows in terms of the healing process. I think that the other thing that people don't know about this job is that it's really, really hard. It's harder than most people think because you hold someone's life truly in your hands in a different way than, say, a surgeon does or an emergency medicine doctor. But it is no less important, and it's extremely hard. And sometimes it's hard not to take it personal. When I get to see people get better is my favorite part of the job, but that doesn't mean that when people remain sick that it's not a fantastic job. It's the fact that I get to help them while they're sick and show them that it's going to be okay. It's just in my heart that this is what I was meant to do, and because I know that people don't ask for this. No one asked to have schizophrenia. No one asked to have bipolar disorder. It is to no fault of their own that this has happened. And it could have been me. It could be my daughter. When I was in medical school, my mother always told me that she wanted me to be the physician that she would want me to have for her. And that has always stuck with me. So I am going to be the physician, the psychiatrist, that I would want for myself if I were in their position, that I would want if my daughter ends up having a brain health condition that's as serious as this. There's no difference in the way that I'm going to treat someone because they have a brain health condition, because I want to ensure that everyone gets what they deserve in terms of the dignity and the health care that they deserve.